For 16 years, the Association of Patients with Mucopolysaccharidosis and Rare Diseases in Głosków has been organizing international conferences dedicated to people suffering from rare, genetically conditioned diseases. This is the only such conference in the Central Europe. During this period, more than 300 lecturers from all over the world have delivered their topics, and there have been over 2,000 participants. In 2018, the conference was held at the Explorers Training and Recreation Center in Serock, at the Zagrzyński Reservoir. It was attended by more than 250 people. The motto of this year's assembly was Understanding Rare Diseases. 44 lecturers shared their experience and knowledge. The scientific committee was composed of 20 scientists specializing in rare diseases. The conference began with a discussion on the diagnostics of rare diseases in the Polish healthcare system. It was attended by representatives of patients' organizations and representatives of state administration, such as Dr. Marek Woch from National Health Fund, Professor Paweł Łuków, an ethicist from the University of Warsaw, Professor Zbigniew Żuber from the Krakow St. Louis Hospital, Dr. Krzysztof Łanda, president of the Watch Healthcare Foundation, Dr. Leszek Borkowski, drug analysis specialist, Marzanna Bieńkowska from the Office of Ombudsman for Patients' Rights, Dr. Jakub Gierczyński and Professor Anna Tylki-Szymańska. For 3 consecutive days, scientists share their knowledge, studying the nature of rare diseases. There were, among others, Dr. Ségolène Aimé from France, who launched an interest in rare diseases in Europe and in the world, the founder and editor-in-chief of the Orphanet Journal of Rare Diseases, who shared their experience in the field of rare diseases. Professor Maurizio Scarpa, who discussed the European Reference Network for Rare Metabolic Diseases, Professor Sylvia Stockler from Vancouver, who presented problems arising in the course of Morquio-B syndrome. Dr. Saskia Wortmann from Salzburg presented her experiences connected with supplementation of riboflavin in 70 patients with ACAD9 deficiency. Dr. Asal Tuliebayeva from Kazakhstan, who discussed the problem of aortic root dilation in patients suffering from Hunter syndrome. Professor Zita Krumina from Latvia, who presented a case of stem cells transplant in a patient suffering from alpha-monocytosis. Dr. Mark Doms from Belgium, who discussed complex medicines for patients suffering from rare diseases and an interesting research result of the awareness of rare diseases among Belgian doctors. We have learned a new outlook of Dr. David Beagley from England on blood-brain barrier transitosis. Professor Timothy Cox from Cambridge presented a role of sphingolipids in health and disease, as well as the significance for rare diseases for the development of new medical technologies. After such an intense session and lectures, an evening barbecue on Friday offered a moment of rest. On the next day, from the early morning, next lecture session began. Professor Shinji Tomatsu from the United States, who participated in the conference for the 11th time, presented his experiences connected with gene therapy in mucopolysaccharidosis. Dr. Mia Horowitz from Israel demonstrated a relation between the Gaucher syndrome with the Parkinson's disease. Meanwhile, Natalia Olkovich from Ukraine discussed the molecular characteristics of the Gaucher syndrome in Ukraine, and Dr. Lapotentova presented the same problem in Belarus. Professor Agnieszka Ługowska presented the gene profile in patients with Gaucher disease. Professor Sass from Germany delivered a lecture on diglyceric aciduria. Professor Natalia Rumiantseva from Belarus talked about clinical and genetic characteristics of Fryns syndrome, and Professor Svetlana Volgina discussed updated diagnostic criteria in tuberous sclerosis. Dr. Jakub Sikora from the Czech Republic presented a very interesting report on cerebellum pathology occurring in acid sphingomyelinase deficiency. And Dr. Marie Vernier from France presented a comprehensive lecture on Niemann-Pick syndrome type C. Professor Ekaterina Zaharova from Moscow spoke about the spectrum of clinical phenotypes in inborn errors of metabolism. Professor Mariusz Więckowski from the Nęcki Institute in Warsaw presented the topic about mitochondrial functioning disorders and its impact on pathological conditions of patients. And Dr. Małgorzata Wiweger presented the usefulness of zebrafish as an experimental model for rare diseases. Professor Szczepanik from the Institute of Mother and Child in Warsaw demonstrated the effectiveness of treatment of refractory epilepsy by autologous transplantation of regenerative cells originating from the fat tissue. Dr. Natalia Pieczatnikowa from Moscow presented encouraging results of enzyme replacement therapy in a patient suffering from Pompe disease. Dr. Holger Prokish presented the latest method of molecular diagnostics by genome wild sequencing RNA. And Professor Anna Tylki-Szymańska from Poland discussed over 20 years of experience in the substitution of enzyme replacement therapy in lysosomal diseases. The subject of the dysmorphological session under the supervision of the Professor Małgorzata Krajewska-Walasek was the agenesis of the corpus callosum in genetic syndromes. Several lectures on this subject were delivered, and the session ended traditionally with the discussion of unknown cases moderated by Professor Robert Śmigiel. All the lectures and presentations were aimed at broadening the knowledge of the both specialists and basic healthcare doctors, who are the first ones to come into contact with patients suffering from rare diseases. It is depending on their competence how quickly the patient will be correctly diagnosed. As Professor Dr. Segele Nemes said, in the past all genetic diseases were considered to be incurable. Now, thanks to the development of knowledge about the mechanisms of their occurrence, a large group of genetic diseases may be treated. And even though full recovery is not always possible, at least the quality of life of the patients is improved. The Saturday official dinner has been a tradition for many years. During the dinner, apart from acknowledgements and granting small souvenirs, participants may informally exchange their experiences. On the last day, all conference participants could take part in consultations of patients who spontaneously came to Serock and who experienced problems with correct diagnosis. An international concilium discussed the problems of each patient, providing recommendations concerning the widening diagnostics or therapy.